Yeah, Jerry. He didn't hear you.
I was looking for a map on that land that we're gonna
I didn't see one in.
sell. If you got a map on that land that we're gonna,
I'm not printing it out.
Kelly, could you print us 3?
This is the street. This is the alleyway. This green area here is going to this landowner. This purple here is going to this landowner. And this one, the guy that owns around that
Where's Delani School?
here.
This would be across the road from the church, across the road and down about half a block from the church, right? Because we've
Yes.
done, because I thought it was kind of part of what the, what we done there a year or 2 ago with the,
Now Johnson, the guy that has the building there.
No, Michael Mahaffey has the house.
No, I mean the Johnson.
Works for us.
They have not built, he has not, he's buying the property from Kennedy. He has purchased it. They have closed. There is no buildings on that property at all.
I was looking at where it is in relation to that gun shop.
Here's the school.
Okay.
There's the school. This is the Johnson property. That, and that one, and that one are all Johnson. This is Mahaffey. We're closing this street, that alleyway
Okay, we're closing this alleyway
in
And-
block 6
and vacating it to
and vacating it to Johnson.
Johnson. Okay.
We're closing this street and vacating it to Johnson. Can I borrow your pen? This street here
Uh-huh.
is going to Johnson because he owns all the way around it.
Okay.
This alleyway, the entire width of this alleyway, Johnson owns the north side, Mahaffey owns the south side.
Uh-huh.
All of that alleyway is going to Mahaffey. Johnson is also selling 20 feet of the south of these 3 lots and 20 feet of the west side of these 3 lots back to Mahaffey.
2.5.
Yep. So this here is, this red stuff is the property Johnson selling to Mahaffey. And this is that 20 feet Johnson selling to Mahaffey.
Okay. So
This
what we're
entire
doing is the
alleyway,
street and the
all we are doing is we are just doing this alleyway to Mahaffey, this alleyway, and this street to Johnson.
Johnson. Okay. Okay.
Time, Kelly.
9:35.
Oh, well, let's bring the meeting to order. Motion to approve the agenda.
so moved.
Second.
Say aye.
Right.
Any discussion on that? Motion passed. Minutes of February 9th, 2021 board meeting.
Motion to approve.
Second.
All aye. Favors, aye.
Right.
Aye.
Opposed, same sign. Okay, number 3, public hearing on road closure and vacation of Delonica.
Moved to open the public hearing.
Second.
All in favor?
Aye.
Opposed, same sign. Open hearing. Any written or verbal comments?
I don't have any written.
All
He's
Pardon?
up for it.
Say your name and tell 'em.
Michael Mahaffey, part of that property. Jason connected with an alleyways. Me and Jake have already had a verbal agreement of what we're going to go on.
Okay, good.
Motion to close the public hearing.
Second.
All in favor?
Aye.
Aye.
Motion carries. Okay, resolution 9/2021, road closure and vacation in Delonica.
Motion to approve.
Second.
All in favor?
Aye.
Opposed, same sign. Okay, motion carried. Public hearing on sale of county real estate. Motion's open for public hearing.
So moved.
Second.
Favor?
Aye.
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 Opposed, same sign. Okay, we're in open hearing, written or verbal comments.
Everybody that is joining property owners is in agreement that this should be done.
Okay. So,
Motion to close the public hearing.
Second.
all in favor? Aye.
Aye.
Opposed, same sign. Motion carried. Okay, resolution 10/2021, sale of county real estate.
Motion to approve.
Second.
All in favor? Aye.
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 Opposed, same sign, motion carried. Okay, review and award purchase of 2021 shuttle XH1000 mower.
Jeff, why do you
Yep.
think there's such a big difference in price on the mower?
That's what I was wondering.
I am not sure. They are for different vendors. The last purchase we bought was a little bit higher than the three we got today. That vendor did not submit a proposal.
Higher than
Higher than the lowest one we've got today.
the lowest. And we're certain that
They
the
are all-
specs are all,
The specs are all the same. I've gone over it with this vendor. And went over each line item, made sure we were getting the exact same thing.
Sure.
And
It's
our last mower, and
same quality of material in it and
same material, same machine. It is not the same machine because the last one we bought was a full bat. This is only a half bat.
why
That's
would,
about the difference.
and why would we not go back to the fullback?
We are selling the tractor that we are getting rid of, that this goes to, is a side mower and a rear mower. We did not pull a full bat with it, full bat wing. We only had a side deck, and this would be similar to what the exact same setup as we had previously,
Oh, it
other
just-
than it's not attached to the actual tractor on the side.
Seems like a big difference in price for if you got the same quality. Have a motion?
I'll make the motion.
second.
All all in favor?
Aye.
Aye.
So same sign. Motion carried. Okay. FY 2020 cost allocation plan for DHS.
Motion to approve.
Second.
All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Review and approve of fuel management equipment for secondary roads.
This here is a fuel system for our secondary road department, and the sheriff also uses. I think emergency management, the courthouse, and DHS also uses. Back in June of last year, I solicited from two companies quotes. This company here is sells the Fuel Master product, and it's going to fit our needs the best in the overall. The other product that we quoted would require us to have monthly subscription and subscriptions, and would extend out our cost, and it was just a few $1,000s more expensive. This system is a one-time fee. There is no no monthly maintenance or no fees, no subscription costs associated to it.
Okay, what other cost factors are we gonna have involved in putting this in then?
For this product, we should not have, they are going to, what we buy here is they come install it.
Okay,
Any additional cost would be very minuscule. There should not be any to this system. There would be a slight cost to it's also supposed to go work very well with and pair with our security camera that we are getting for the fuel island out there. And they will be able to piggyback on the same system.
now is this gonna include you getting put up the new fuel shed?
This does not require, all this requires us is to put up a tower. We're going to anyway for light and the camera. And that's the only thing else we're doing.
So you'll use existing,
Everything is existing. We might have a little bit of concrete work, but that goes along with our new depth tank once we install it permanently. But for this fuel management system, what they come down and do today is all in this price.
Can you tell me, what does this do?
This new fuel system.
Yeah,
So our current fuel system is outdated. It is operating on Windows 95 and cannot be put on anything newer. A few weeks ago, we had a down system due to a failed keypad. And then again today, it is down again today. We think it's all just frozen up. This one here will allow us to monitor our fuel levels. It's also a tank monitor. We've got a tank monitor system that is just spitting out a bunch of code. Nobody knows what it means. And has an alarm that goes off whenever the wind blows or thunder shakes. We're not really sure. We get a little bit of water in it and the alarm will go off. This system here would bring us more up to date and should be more user friendly.
so this is the above ground, really just monitoring system of what's happening there?
So this here is a tank monitor. It's a computer that's replacing a computer that is mounted on a wall in our shop that monitors the fuel levels. That is the tank monitor system that we're replacing. And then also we're replacing the user interface that turns on and off the pumps out in the actual shed. We're not replacing any of the pumps, the tanks, or anything like that. This is just basically the computer software that turns everything on, records where fuel is used. By the DNRs, per the DNR, we are required to know where every ounce of fuel is used at. That we're not spilling it, putting it back out into the environment, but we're supposed to keep of the record. We're supposed to keep records of each equipment we put it in, how many gallons. This here will do that.
and what's to keep it from freezing like the new one, the one you got?
I'm not really, there's nothing that's, other than it's just newer. We're not sure if it's frozen. That's just our best guess at the moment, as of this morning.
Okay.
So is this part of what you were talking about, kind of their budget time on needing this replaced?
Yes.
Or would you look at like more, like we were originally like talking about the pump and everything kind of being?
So the other stuff that needs to be done, we were originally thinking that we would have to trench in a new utility line out there, bring out new supply of power. This system does not require that.
It's wireless.
It is wireless. With this tower that we're going to build, this additional tower that's not on that quote, we're mounting a point-to-point communication. So we'll put a receiver on a building and put a transmitter on a pole, and it will shoot data directly over to our building. And that's also what we will be mounting the security camera to, and a night light.
Okay, motion to approve.
Second. All in favor?
Aye.
Opposed? Okay, we had a little discussion. Motion passed. Resolution 18/2021 homestead disallowance for 2020 payable 2021-22.
Second.
All in favor, aye.
Aye.
Opposed, same sign. Motion carried. Okay. Resolution 19/2021 military discount allowance for 2020 payable 2021-22.
So move.
Second. All in favor, aye.
Aye.
Opposed, same sign. Motion carries. Resolution 17/2021 naming depositories.
So moved.
Second.
All in favor?
Aye.
Opposed, same sign. Motion carries. Wapello County COVID vaccine rural clinics for 65 and older.
Just want to give you a little quick update on one of our next initiatives, getting vaccine out, that Linnell and I have been working on. We've heard a lot from seniors with the current program of pushing vaccine out to pharmacy partners and clinics with frustration over their online signups. We know that's very tricky for a lot of our folks, and maybe especially for some folks in the rural area that maybe have broadband issues or doesn't have connectivity at all. So we kind of come up with the idea to give them a person to talk to. That's what they want. They want a phone call, a phone number they can call and talk to a person. And so we partner with all the small town city clerks and Deb in your office to divide up the townships and the cities and be that point of contact for those seniors that live in those areas. And we'll be taking their phone calls this week and next week and creating a sign up basically. I've looked at the census numbers just to understand what the estimates are as far as where the seniors are in those townships. And we kind of have a general idea of what our potential maximum number is. And just overall between the city of Ottumwa and Wapello County, I told you before, we have 6,000 seniors over 65. About 1,800 of those are in our rural areas and 4,200 of those are in the city of Ottumwa. So we've been pushing vaccine to our local pharmacies in town. And to date, that's been about 1,200 doses. And knowing not all of those are going to Wapello County residents because we're kind of the center of commerce for surrounding counties as well, but that just kind of gives you an idea. Once we get the numbers collected at the end of next week, we'll look at those and see what, how we need to plan. And we'll take those clinics out to those city halls and then we'll call these folks back and say, this is the clinic time and place to be. And then they don't have that far to go. Those signups are out there now. We've published those graphics. Our media partners have had it out over the weekend and the calls are starting to roll in. So it's just kind of one of the latest things we're doing to make sure we don't miss anybody and we continue to chip away at that 6,000.
Well, like I say, this morning, our phone's been ringing off the hook up there. And like I said, our clerk doesn't come in until 10.
I think we'll change that. Like to 8, starting at 8 and go till 2.
I think it'll be pretty heavy this week and maybe finish up next week, but I think it's a lot of phone calls, but I think it's a worthwhile time spent.
Now on this, when you tell us that there are 1,800 of these seniors live out in the rural area and 4,200 are inside the city limits of Ottumwa, have you approached the city of Ottumwa to help us pay for this operation?
So right now, we don't really have any direct costs as far as the extra time to answer the phones and that kind of thing. But it's not creating any overtime.
We would have extra costs.
Yeah, we've spoken to the city about if we later on do a clinic in town, where we could host that and what that would look like.
A clinic for
Like a
shots?
Yeah, vaccination clinic.
I mean, you mean they're interested in helping us pay for it or
Limited that.
finding a place for it?
tentatively, Bridgeview said they would help. Indian Hills actually came to us a few weeks ago proactively, and we've met with them. So we have options as far as locations. What our tripping place will be is just what we're doing right now, the manpower to do the registrations. And so that we have not spoken to them about as of yet, because our plan in town is to utilize the pharmacies. Because it's a lot easier for folks in town to come to a local pharmacy or potentially get help. Our rural seniors don't have that luxury necessarily, because there may be, like I said, either rural broadband issues, they can't get on the internet, or don't have help as close to make phone calls. We have worked out a program with 1015 Transit. If someone needs help getting to a site, we can make that happen, and they're not charging for that.
So what these city clerks are doing, and our clerk, they're signing people up for the vaccination. Are they signing them up at a specific location to be vaccinated?
That'll be the next step. Once all this initial registration is collected, we'll look at our list of names, what our numbers are in each of those areas, and put them on a schedule, and then call them back and say, your scheduled time and place is here. Can you make it? Do you need transportation? And it's very meticulous and very time consuming. And the reason it's necessary is just because of the way this vaccine works. It's not like a flu shot where you can just go get your flu shot and leave. Once we crack that vial, we have to use it all within 6 hours because there's no preservatives in it like a typical flu shot. And there's 10 doses in a vial. So we want to make sure we have those groups of 10. And then when they get their vaccine administered, they need to sit and be monitored for 15 minutes to make sure they don't have a reaction. And that's because it's a new vaccine. We just want to make sure that there's not some unknown issues that could crop up. We've not seen that, fortunately, but that's still the protocol. So it's a bit of a timing issue. Bring in your group of 10, administer, monitor 15 minutes, bring in the next group of 10 and have that.
Have you got a figure of what we have spent of our CARES money on this project, not just this part today, but getting up to today, including the clinic?
For vaccine, we haven't had a lot of costs yet, and I will be updating that spreadsheet you're asking about on the testing clinic here.
Well, I'm looking at the cost for the nurses, the rental, everything. Do you have a ballpark figure of what the county has spent so far?
Not off the top of my head, that's on that spreadsheet. But I can update, I'll be updating that and bringing it back to you.
Okay, that'd be good to have.
A lot of that is because I'm still applying to get as much as I can from the FEMA channel. So it's coming out of federal funds. And we've had pretty good luck doing that so far. So our costs have been actually pretty minimal out of our own funds so far. We may need to look at, Linnell has discussed maybe contracting LPNs to help with the vaccine, because we don't necessarily have to have RNs for that. But we're not quite there yet.
So do you think after this 2 weeks of sign up that we're going to be opening up a site like we discussed with Indian Hills?
Well, the plan for the rural seniors is to take it to them. So we'll have remote sites in each of the communities for those seniors to come to. You've seen that graphic we published, right, where each township is assigned to a city. We'll be working with those different communities to help host a site. For example, we talked with Ellen about using the Katy Center to host a clinic site. We may use the fire station and agency, same thing in Eddyville, that kind of thing, or a city hall. We'll take that clinic out to those locations.
Now, at the end of this 2 weeks, on the 26th, will the city clerks and our clerk stop taking calls then? It's a 2-week period.
That's the intent. We feel that's plenty of time, hopefully, that everybody sees this information, calls in, gets their name on the list. We'll work with folks. We want to hold to that because it's a planning thing. We need to know those numbers so that when we sit down the first week in March and decide how many doses we have in each spot, it really complicates things if somebody's trying to get in and they've not been, counted for. if we have extraneous circumstances, we can work around that, but we don't want that to be applicable.
Now, what about the people, and this would include in town too, that have already had their first shot? What do they have to do to make arrangements for the second shot?
Wherever they receive their vaccine, their first prime dose from, should be calling them when it's time, 4 weeks later, or a little bit sooner, to schedule that second dose. So
Okay.
the booster doses are automatically shipped from the state to those locations as Linnell dictates. And then those facilities will call that person. There was some learning curves, like with the Hy-Vee system, where initially they weren't able to set up or schedule their second dose online. They can do that now. So those folks that did that before February 10th, they'll be making those phone calls to get that squared away.
There's still been some concern about those people who, and we have a lot of them that have had the virus already in Wapello County. They've been told different stories, not by you, but where this the media or, some nurse has told them that, no, you can't get one for 3 weeks. No, you can't get one for 4 weeks. No, you can't get a shot until do you know what the real story is yet if you've had the virus?
We're encouraging folks to talk with their primary care physician, see what they say, and even then, you're correct, there is some different opinions.
Yeah.
I've heard that. Some will say wait 3 months, some will say wait 6. I don't know that there's a hard, fast gospel on that yet, because they're still researching that. We anticipated the CDC would come out and say that immunity lasts a minimum of 6 months, not just the 90 days. I couldn't tell you if they've done that yet or not. It's kind of an evolving thing as these studies continue to play out as we go along here. And it's just that waiting game as we need more time to actually see what it does. And now they're dealing with the variant strains and trying to understand the behavior of the variant strains.
Well, there's something that a lot of our people are concerned about because, they've suffered through this once. They're afraid to go get the shot now because they might have some kind of effect if it's too soon. If they wait till it's too late, then they may end up getting it again. So there is
And we still don't really
concern.
understand reinfection and how that happens.
Yeah.
A lot of valid questions. And these are things we discuss in our weekly healthcare coalition meetings and just talk about it as clinicians. We're really kind of at the mercy of whatever the CDC publishes as they look at the controlled studies. A lot of great questions. Unfortunately, I don't have all the great answers yet.
Well, I'll tell you, I am, and I think the board is too, well pleased with you and Linnell's progress on this. We may ask you questions you don't have answers for, but that's because somebody's asking us. And they probably know us a little better than they know you and Linnell, so we get the calls on it, or we'll see them on the street and they'll ask. And so I think you guys have done an excellent job on setting up where we're doing the testing. We appreciate the recommendations that you guys gave us about, we contracted for another 11 weeks, but you came back instead of just saying, well, we already did it, we'll go 11 weeks. You came back with an update that pointed out we don't need it for another 11 weeks. Let's better utilize those nurses somewhere else, doing something else. So that's the kind of stuff we need to hear. And you and Linnell have done an excellent job of getting that information to us so we can make those decisions.
I appreciate that very much, Jerry. And I'll say, and on Linnell's behalf too, our success wouldn't be possible without the support of this board. So I think it's went very well in this county because of all of us working together, and we're going to keep plugging away.
Well, you know that if there is any problem comes up or any question, we're here every day, and it doesn't take us long to make a decision on it if you need something different done, something that'll benefit the public more than what we're doing. We are available. And I think this idea, whoever thought of it on using the clerks is a good idea. It's another opportunity to help the public. And those are the kind of things this board really appreciates you and Linnell coming up with those ideas.
I can tell our clerks were all about it. They're excited to be part of it. They understand it's gonna be a little work for a couple of weeks, but absolutely well worth it.
Well, I think everybody's starting to realize now we are in a battle. You know, this is not just a thing, well, let's spend a little time on it today. This is a battle, and we're looking at people's lives. So anything we can do that is to help the public, a little bit different than what we thought maybe 2 months ago was the right thing to do, we certainly want to do it. That's why we ask these questions about those that have already had it. You know, what do we tell them? So.
And I appreciate the questions, because that's, you know, they sometimes say the answers are easy, the questions are hard. Ask the hard questions, because we need them.
Well, we appreciate you guys' efforts. It's too bad that we don't have a graph here that says because you did this, you saved this many lives. But we know there's lives that have been saved out there. People that did not know that they had the virus, and when they got tested, found out they did have.
I concur. It would be nice to know those stories, and you know what, they'll come later on. Sometimes you don't know the impact of your actions until later, but yeah, the testing was a venue to keep people working and keep their families safe. And, you know, it's kind of like most of the weekend I spent working with organizations to work on the cold sheltering, and we did impact some lives, and every single one of them we impact is worth it.
But you know, through the years in my involvement with emergency management, we've had different kind of practice sessions, and we'd have tabletop demonstrations. And I remember one, we went out to the hospital, and he said, all right, a bomb just blew up half the hospital. What do we do now with the other half? How do we treat that? And there's times you think, why are we doing this? This is why we're doing it right here. Because that one day that comes, we got to be ready. It can't be, oh, what do we do now? We have to be ready. And I think the fact that you guys have been so ready is because of this day was coming and you prepared for it.
You're correct. And sometimes those exercises are relationship building, and that's what it's all about. Is who can you call on and ask for advice, ask for support, like the city clerks, like the board. I just think we have a really strong network of a lot of professionals in the county, both public and private, and we're reaping the benefits right now.
It's a team effort.
Mm-hmm.
What it is.
It takes all of us.
Yeah.
Well, we thank you.
Thank you, Jerry. Thank you, board.
Thanks, Tim.
Okay, personnel, request for payroll approval of change of employment for Della Ramirez from clerk 2 to clerk 3.
Move to approve.
Second.
All in favor?
Aye.
Aye.
Opposed, same sign. Motion carries. Okay, we got any other business?
Everything's out and running today.
Everything is
Good.
going. I do not know of any breakdowns.
Motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Opposed, same sign. Okay, we're adjourned.